Hi, and thank you so much for watching. I thought I'd dive straight into the next topic of the series of videos that we're going to talk about. And this topic today is about emotion and how it affects us physically. So, I never believed it. At uni, I heard about it, but I guess I was a skeptic and I was very sort of headstrong, orthodox in my way of approaching conditions, musculoskeletal conditions, and organic conditions. For me, it was all about having a firm diagnosis, and then based on the tissue in lesion, then you treat accordingly, or you'd refer. So, excuse me. So it was very much about um, having a clear diagnosis based on pathology, tissue in lesion, with a firm diagnosis. And then years down the track, I started to see that having a multitude of patients coming in, some were spiritual, I had some shamans, I had psychics, and I was always open to discussions with them. And I actually found them pretty cool because they'd obviously illuminate concepts that I frequently never thought existed, like matrix and um, things like looking beyond the veil, which again are very metaphysical concepts. And they would talk to me how emotions can directly affect musculoskeletal conditions, which just blew me away. For instance, someone might have lack of financial support and they'd have back pain, or they'd have a lot of responsibilities, the weight of the world on their shoulder, and they'd have neck and shoulder conditions. Now, with neck and low back pain, I'm not going to discount or discredit that it could be from a nerve, a disc, a ligament, a muscle. Yes, I'm a believer in that. But I'm also now entertaining ideas, and I feel that there is a greater awareness, particularly in the allied communities as well, about neuro-emotional or emotional, psychological overlays on top of the diagnosis, in which case you'd have to clear both, or you take away the emotional concept. You'd clear the emotion, and then you'd see whether the musculoskeletal aspect would still be present. If it is, then you treat that as well. But big believer in emotional manifestations and how it affects organic presentations and musculoskeletal presentations. Like, for instance, someone that has extensive grief, chronic grief, could have lung issues. Someone that has anger issues could have liver problems. And there's charts, emotional presentations. No, where the strong emotions are concentrated in body parts, and you can Google that and you can see it, and it's pretty cool. I'm a total believer. I'm no longer a skeptic, and I, if you have a discussion with a patient and you take a thorough history, you may also see correlations. They might tell you, "Oh, I lost my job recently," and bang, they get back pain, or they've just moved, big shift in their life, feeling lack of emotional support, and boom, they'll get back pain or neck pain because they've got a lot of new responsibilities. So think about that. Very important. And you can use it in your day-to-day life. If you're battling particular issues with your body, look to see, ask yourself the question, is there a musculoskeletal, is there a dominant emotion going on here? And if so, how can I address it? Ask yourself, what do I need to learn in order to overcome this emotion? Or how can I help myself get over this emotion? And sometimes the higher self could give you your answers. So be open to it, and realize that emotions, toxic emotional thoughts, can cause an impact on our physiology. Thank you for listening, and I'll see you in the next video.